A friend recently described to me a time when she woke up to her toddler's screams in the middle of the night. She found her daughter standing on her bed, eyes wide open and screaming with fear. As she tried to calm her 3-year-old, it quickly became obvious that the child was still asleep, and she couldn't wake her up. My friend eventually got her daughter to lie back down and close her eyes, but it was pretty upsetting for them both. Now, my friend thought her daughter was having a really awful nightmare, but actually it was a night terror. Both nightmares and night terrors are pretty common in kids. In adults, they may be a symptom of underlying trauma. And in this video, I'll explain the difference between night terrors and nightmares, as well as some things you can do to alleviate both. Nightmares and night terrors are often lumped together, but they're actually quite different. If you have PTSD or a history of trauma, nightmares can be a really common symptom. But I've recently learned that night terrors can also be a symptom of trauma occasionally. Usually not, but sometimes. So today we're going to break down the differences so that you can know what to do about them, whether for yourself or a loved one. Okay, so what are nightmares? You're probably more familiar with nightmares because you might remember having one. That's one of the things that differentiates them from night terrors. The reason you can remember a nightmare is because it's a vivid, disturbing dream that happens during REM sleep. This is the last sleep stage, and it's where most dreaming occurs. Nightmares tend to have a strong emotional content, fear, anxiety, sadness, even guilt, and they can feel incredibly real. The fear that lingers after a nightmare can also make it hard to fall back asleep. Now, it's normal to have the occasional nightmare, but when they become chronic or so distressing that you dread going to sleep, that's when we start looking at nightmare disorder or PTSD. And we're going to talk more on that later. Okay, so what are night terrors? Night terrors, which are also called sleep terrors, are intense episodes of fear that occur during deep non-REM sleep. This is stage 3. This is deep sleep, and it's usually in the first few hours of the night, usually in the first or second sleep cycle. Now, these can look really scary because the child or adult might scream, thrash about, they might show intense fear, they might be sweating and have rapid breathing, and they look awake. A lot of times their eyes are open, but they're confused and they don't respond to you. Usually, you can't wake them up or comfort them. Now, night terrors are a form of parasomnia. This is a type of sleep behavior that includes sleepwalking, sleep talking, sleep paralysis, and bedwetting. Now, these episodes typically resolve on their own, and the person will usually fall back into a restful sleep without remembering what happened. Unlike their partner, who will probably definitely remember the situation and have a hard time falling back to sleep. Okay, so night terrors and nightmares are two different states. So let's look at the different factors that cause them. Poor sleep, stress, medication, and some other factors can contribute to both of them. And both night terrors and nightmares are much more frequent and common in children. They usually peak between the ages of 3 to 7. Between 10 to 30% of children experience night terrors, and 10 to 50% experience nightmares. This goes down quite a bit for adults. About 1 to 3% of adults have night terrors, and 2 to 8% of adults have nightmares weekly. But that number completely changes when someone has a history of trauma. Nightmares are a common symptom of PTSD. Research shows that 70 to 90% of PTSD sufferers have nightmares. Now, when nightmares become frequent, distressing, and interfere with sleep in daily life, it may be a condition called nightmare disorder. So let's dig a little bit into that. Here are the signs of nightmare disorder. Recurring nightmares at least once a week, anxiety about falling asleep due to fear of nightmares, fatigue, poor concentration, and mood issues from sleep loss, and nightmares that significantly impact mental health or daily function. So they're so distressing that you can't stop thinking about them. And a lot of times we'll see behaviors of avoidance around nightmares. So people might be using substances to avoid having nightmares, or medications to avoid having nightmares, or just avoid going to sleep. That leads to more sleep deprivation, which causes more problems. So nightmare disorder, it's often linked with stress, trauma, anxiety, depression, and medication side effects, or poor sleep hygiene. Okay, so now that we know the difference between night terrors, nightmares, and nightmare disorder, we can tailor the right treatment to the related problem. So the first line of treatment for any of these sleep disorders is improving sleep hygiene. This includes sticking to a sleep schedule, reducing sleep time before bed, and creating a relaxing environment and nighttime routine. It's also important to avoid drugs, caffeine, or alcohol, as all of these interfere with healthy sleep. Now let's talk about some specific treatments for nightmares and nightmare disorders. Okay, first, let me tell you about a technique that's effective for 60% or more of people with nightmares. It's called Imagery Rehearsal Therapy. And I made a video about this so you can learn it, but I'll give you the short version. During the daytime, you write out your nightmare, and then you change the ending so that the problem is resolved. You can get really creative about how you rewrite the ending. And here's why this works. One of the reasons that your brain makes nightmares is it's actually trying to process memories and emotions during REM sleep. It's trying to work through them. But with PTSD, the processing system can get overwhelmed. It actually, with PTSD, your cortisol doesn't get turned off. And so you wake up in the middle of the dream without resolving it. It would be like turning off the Lion King right after Mufasa dies. It's got a traumatic ending. So instead, you want to help your brain process to the end of the story. Hakuna Matata, redeem Pride Rock, restore balance to the circle of life, etc., right? When you write the new ending, your brain knows how to finish the dream, and it doesn't have to keep reliving that nightmare over and over again. Okay? Another thing that can be helpful is reducing stress and anxiety. So relaxation techniques like deep breathing or even therapy can help reduce the frequency of nightmares. You can learn how to regulate your nervous system with my free grounding skills course, and I'm going to make sure and link that below. But in that course, I teach body-based skills to turn on the parasympathetic or calming response in your nervous system. Okay, next, if nightmares stem from past trauma, trauma-focused therapy like EMDR can be really effective. A good therapist can help you learn the skills to work through the underlying trauma that causes your nightmares. I also have a course in my membership called How to Process Trauma with a lot of skills to help you process through and resolve trauma instead of coping with it or avoiding it. Okay, and lastly, medication can be helpful. So some medications like prazosin, they can be used in severe cases to reduce nightmares, especially with PTSD. However, it does come with some side effects. So always work with your doctor when you're trying to figure that stuff out. Okay, now let's look at treatment for night terrors. Night terrors usually have nothing to do with PTSD. They're usually related to growing up or a sleep phase issue, a parasomnia, but they can occasionally be caused by trauma. And this is especially true for combat veterans or for those with childhood trauma. Standard night terrors usually have vague themes, they're sporadic, and the person doesn't remember them. But with trauma-related night terrors, it might have violent or aggressive themes. It might be chronic, right? It might happen every single night, and sometimes the person does remember it. So if you have PTSD to work through, trauma-focused therapy might help your night terrors. For most people experiencing night terrors, treatment is just all about keeping the person safe. So here's 5 things you can do. Wait it out. Since night terrors happen during deep sleep phase and they're not remembered, trying to wake the person up during the night terror can make it worse. It's usually best to let the episode pass naturally. Number 2, keep a regular sleep schedule. Sleep deprivation can trigger night terrors, so prioritizing adequate, high-quality sleep can help reduce episodes. Okay, number 3, this is probably one of the most effective treatments for night terrors. If night terrors happen at the same time each night, gently waking the person up 15 to 30 minutes before the usual episode can prevent them. And this is usually the most effective treatment for night terrors. Okay, next, sleep safety precautions. So for people who move around or thrash violently, make sure their sleep environment is safe. You might have to remove sharp objects, or you might have to make sure that furniture is secured to the walls to prevent injuries. Okay, and then lastly, if night terrors are chronic or they're dangerous or they don't seem to fit the normal pattern, you can do a sleep study or see a sleep specialist to rule out any other conditions that might be contributing. Okay, so there you have it. While nightmares and night terrors can be unsettling, they're usually manageable with the right strategies. Nightmares are often tied to emotional stress or trauma, and addressing those underlying issues can bring relief. Night terrors, on the other hand, tend to be a phase that children outgrow, but ensuring good sleep hygiene can make a big difference. And if nightmares or night terrors are severely impacting your sleep or your ability to function, getting professional help from a therapist or sleep specialist is a great next step. I've also made a couple of videos teaching some of these impactful techniques to decrease nightmares, so make sure to check those videos out. Sleep, as we all know, it's really essential to mental and physical health, so it's worth finding ways to make it as restful as possible. Okay, thank you so much for being here, and please take care. Hey, if you found any part of this video helpful, I'd really appreciate it if you could give it a thumbs up or comment below what you found was helpful. Also, if you can think of someone who might benefit from this video, if you could share it, that'll help them. But all of these things help tell the algorithm that this content is helpful for people, and then they'll show it to more people who it can help. So really appreciate it. Thank you so much for being here. Take care.